Hello, my name is Casey.
And hello, my name is Katie.
And today we will be talking to you about being diagnosed with hepatocellular carcinoma.
It can be a scary and confusing thing being diagnosed with this disease, but we're here to clarify some of the things you will be encountering.
Let's start talking about what exactly hepatocellular carcinoma is. HCC is a cancer that starts in the liver. HCC has also been commonly called hepatoma. HCC begins in your main liver cells, called the hepatocytes. HCC is the most common form of liver cancer.
There are several treatment options for HCC. These treatment options include surgery, liver transplant, ablative techniques, which is using extreme temperature to destroy cancer cells, and intra-arterial therapies, which is a treatment delivered via a catheter to the cancer cells, and chemotherapy.
One type of chemotherapy drug is sorafenib. Sorafenib is a tyrosine kinase inhibitor, angiogenesis inhibitor, a VEGF inhibitor, and a RAF kinase inhibitor. We will explore what this drug truly does. The multi-kinase inhibition will stop the signal cells that tell the cancer from forming new blood vessels in order to survive. This will also tell the cancer cells to stop growing and dividing in your liver.
Sorafenib blocks vascular endothelial growth, factor inhibitor VEGF. This means that the drug will stop angiogenesis, the forming of new blood vessels, and target the blood vessels that supply oxygen to the cancer cells and cause the cancer cells to starve, ultimately starving and shrinking the tumor.
Nexavar will also block the RAF kinase. The RAF signaling is initiated by tyrosine kinase inhibitor. This is also why Nexavar helps as a tyrosine kinase inhibitor. The RAF kinase proteins help control the pathway that controls cell differentiation, growth, and proliferation. By also blocking the RAF kinase pathway, Nexavar is able to slow down or stop the cancer's ability to regulate cell proliferation and survival ability in your liver.
Supplements to Nexavar are Sutent and Avastin. Both of these drugs can also be used along with Nexavar in order to target and inhibit the vascular endothelial growth factor to ensure that the tumor will be starved and will eventually shrink.
Administration of Nexavar. Nexavar is an oral anti-cancer medication. Nexavar is also administered by tablets. These tablets need to be taken 2 times a day and with 2 tablets, totaling 4 tablets each day. Your doctor may change your dose during treatment. The recommended way to take Nexavar is by taking the 2 sets of pills 12 hours apart by mouth and without food. It's recommended that you take Nexavar 1 hour before eating and 2 hours after you've eaten.
Now, as with all medications, there are side effects to Nexavar. These include diarrhea, fatigue, hypertension, decreased blood flow to the heart attack, bleeding problems, high blood pressure, hand, foot, skin reactions, skin and mouth reactions, opening in the wall of the stomach or intestines, wound healing problems, changes in the electrical activity of the heart, inflammation of the liver, birth defects or death of an unborn child, change in the thyroid hormone levels. Be certain to communicate with your doctor if you are starting to feel any of these listed side effects.
We hope that this video has helped clarify some of your concerns about being diagnosed with hepatocellular carcinoma.